The rabies virus. Let's start with a virus that has a 99.9% fatality rate once symptoms appear. Not 50%, not 70%, 99.9%. If you start showing symptoms of rabies, you're basically already dead. The rabies virus is transmitted through the saliva of infected animals, usually through bites. A cute dog bite, a bat scratch, even a lick on an open wound can be enough. The virus then travels through your nerves toward your brain at about 3 millimeters per hour, slow enough that you might not notice anything for weeks or even months. But once it reaches your brain, all hell breaks loose. The virus causes acute inflammation of the brain, leading to a terrifying set of symptoms. You become afraid of water, not just uncomfortable, but genuinely phobic. Trying to drink water triggers violent throat spasms so painful that patients refuse to drink even when they're desperately thirsty. This is called hydrophobia, and it's one of the most disturbing symptoms in all of medicine. You also become hypersensitive to air currents, light, and sound. A gentle breeze on your face can trigger panic attacks. Your personality changes completely. You become aggressive, confused, and hallucinate. Some patients bark like dogs. Others try to bite people, spreading the virus further. Then comes paralysis, coma, and death, usually within days of symptoms appearing. Here's the truly terrifying part. Only 14 people in recorded medical history have ever survived rabies after symptoms appeared. 14 out of tens of thousands of cases. One girl, Gina Geese, survived in 2004 using an experimental treatment called the Milwaukee Protocol, but the treatment has failed in almost every other case since then. The good news? There's a vaccine, and if you get it immediately after exposure, before symptoms appear, you'll almost certainly survive. But once symptoms start, you're done. The virus has won. Rabies kills around 60,000 people per year, mostly in Asia and Africa where the vaccine isn't readily available. It's been terrifying humans for thousands of years, and it's still out there, waiting in the saliva of infected animals. Pretty freaky stuff, right? Ebola virus. In 1976, a mysterious illness appeared in a village near the Ebola River in Zaire, now the Democratic Republic of Congo. People started bleeding from their eyes, nose, and mouth. Their internal organs liquefied. They died in horrific agony within days. This was humanity's first encounter with Ebola, and it remains one of the most terrifying viruses on the planet. Ebola has a fatality rate of 50 to 90% depending on the strain and the quality of medical care. The Zaire strain, the deadliest variant, kills about 90% of those infected. For comparison, COVID-19 has a fatality rate of around 1 to 2%. Ebola is 45 to 90 times deadlier. The virus attacks your blood vessels, causing them to leak. Your blood can't clot properly, so you bleed internally and externally. You vomit blood. You have bloody diarrhea. Your organs fail one by one as they're deprived of oxygen. In the final stages, patients bleed from every orifice: eyes, nose, ears, mouth, even pores in their skin. It's called hemorrhagic fever, and it's as horrifying as it sounds. The 2014-2016 Ebola outbreak in West Africa killed over 11,000 people. Healthcare workers were hit especially hard because the virus spreads through contact with bodily fluids. Caring for Ebola patients is incredibly dangerous. One slip, one breach in protective equipment, and you're infected. There's now a vaccine and improved treatments, but Ebola still has no cure. If you catch it, your survival depends on aggressive supportive care and luck. The virus is still out there in animal reservoirs, primarily fruit bats, waiting for the next outbreak. And with climate change pushing animals and humans into closer contact, that next outbreak could happen anytime.
Marburg Virus. Imagine Ebola's evil twin. That's Marburg. Discovered in 1967 when lab workers in Marburg, Germany got infected from African green monkeys, this virus has a fatality rate of up to 88%. Marburg causes the same hemorrhagic fever as Ebola, bleeding from multiple orifices, organ failure, and a horrible, painful death. But Marburg is even more unpredictable. Some outbreaks have killed nearly 9 out of 10 infected people. In 2004-2005, an outbreak in Angola killed 90% of those infected, the highest fatality rate ever recorded for a hemorrhagic fever outbreak. Entire families were wiped out. Healthcare workers fled hospitals because treating Marburg patients was essentially a death sentence. The virus incubates for 2 to 21 days, meaning you can be infected and spreading it without knowing. And once symptoms start, fever, headache, muscle pain, it progresses rapidly to vomiting blood and multiple organ failure. There's no vaccine, no specific treatment, just supportive care and hope. Marburg is so dangerous that it's classified as a biosafety level 4 pathogen, the highest level. Labs that study it require the most extreme containment measures: spacesuits, airlocks, negative pressure rooms. One accident, one breach, and you've got a potential pandemic on your hands. The virus still appears sporadically in Africa, carried by fruit bats. Every outbreak is a race to contain it before it spreads. So far, we've been lucky, but our luck won't hold forever.
Smallpox. Before 1980, smallpox killed 300 to 500 million people in the 20th century alone. Let that sink in. 500 million people. That's more than World Wars I and II combined. Smallpox had a fatality rate of about 30%, but the survivors weren't lucky. They were left with deep, disfiguring scars all over their bodies, especially their faces. Many went blind. The disease was so devastating that it shaped human history. The virus spreads through the air, making it incredibly contagious. You'd get a fever, then painful pustules would erupt all over your body, inside your mouth, throat, and even your eyeballs. The pustules would fill with fluid, then scab over. If you survived, you'd be left permanently scarred. But here's where it gets interesting. Smallpox is the only human disease we've ever completely eradicated. Through a massive global vaccination campaign, the last natural case occurred in 1977 in Somalia. In 1980, the World Health Organization declared smallpox extinct in the wild. So why is it still on this list? Because the virus still exists. 2 labs in the world, one in the US, one in Russia, keep samples of smallpox for research purposes. That's it. 2 labs holding on to a virus that killed 500 million people in 1 century. And here's the terrifying part. No one born after 1980 has been vaccinated against smallpox because we didn't need to anymore. That means most people under 45 have 0 immunity. If smallpox ever escaped from those labs, or if someone weaponized it, we'd have a catastrophic pandemic. Bioterrorism experts consider smallpox one of the greatest threats to global security. It's airborne, highly contagious, and most of the population is vulnerable. A deliberate release could kill tens of millions before we could respond. The virus is technically extinct, but the samples remain, locked away in freezers, waiting. Hantavirus. In 1993, a mysterious respiratory illness killed several young, healthy people in the Four Corners region of the southwestern United States. They were perfectly fine one day, then suddenly they couldn't breathe, and within hours, they were dead. The fatality rate was over 50%. This was Hantavirus pulmonary syndrome, and it's still one of the scariest viruses in North America. Hantavirus is carried by rodents, especially deer mice. The virus is in their urine, droppings, and saliva. When these dry out and become airborne dust, you can inhale them. You don't even need to touch a mouse. Just breathe in a dusty area where infected mice have been, and you're at risk. Early symptoms are flu-like: fever, muscle aches, and fatigue. Then suddenly your lungs fill with fluid. You can't breathe. You're drowning in your own body. It progresses so rapidly that people have gone from feeling slightly ill to needing a ventilator in just a few hours.
The fatality rate in the US is about 36%. There's no cure, no specific treatment, and no vaccine. If you catch it, doctors can only provide supportive care and hope your immune system wins the fight. What makes hantavirus particularly terrifying is how easy it is to encounter. Cleaning out a shed where mice have been living, you're at risk. Camping in areas with rodent activity, at risk. Working in agriculture or forestry, at risk. Every year, dozens of people in the Americas contract hantavirus, and about a third of them die. It's a reminder that deadly viruses aren't just in tropical jungles or research labs. They're in the shed in your backyard, waiting in mouse droppings.
Nipah virus. In 1998, pig farmers in Malaysia started dying from a mysterious brain infection. At first, doctors thought it was Japanese encephalitis, but something was wrong. The fatality rate was much higher, around 40%, and it was spreading rapidly. This was Nipah virus, and it's one of the World Health Organization's top priority diseases for research because of its pandemic potential. Nipah attacks your brain, causing severe encephalitis, inflammation that leads to seizures, coma, and death. Some patients recover, but many are left with permanent neurological damage. And here's the scary part. The virus can remain dormant in survivors and reactivate months or even years later, causing delayed encephalitis. The virus spreads from fruit bats to pigs to humans, or directly from bats to humans through contaminated fruit or date palm sap. In some outbreaks, it's also spread person to person through respiratory droplets, making it potentially pandemic capable. Outbreaks in Bangladesh and India have shown fatality rates as high as 75%. In 2018, an outbreak in Kerala, India caused panic as doctors raced to contain it. Healthcare workers and family members of infected patients were quarantined. The outbreak was contained, but it revealed how quickly Nipah can spread and how deadly it can be. There's no vaccine for humans, no specific treatment, and the virus has a wide range of animal hosts, making eradication essentially impossible. Scientists rank Nipah as one of the viruses most likely to cause the next pandemic. It has a high fatality rate, can spread between humans, and exists in animal reservoirs across Asia where billions of people live. Every outbreak is a warning. One day, we might not contain it in time. Lassa Fever. In West Africa, there's a virus that infects 100,000 to 300,000 people every year, killing around 5,000. Most of the world has never heard of it, but Lassa fever is a constant threat in countries like Nigeria, Sierra Leone, and Liberia. Lassa fever is another hemorrhagic fever, though usually less severe than Ebola. About 80% of infections are mild or asymptomatic, but for the other 20%, it's a nightmare. High fever, bleeding, facial swelling, fluid in the lungs, seizures, tremors, and disorientation. The overall fatality rate is about 1%, but among hospitalized patients, it jumps to 15 to 20%. The virus is carried by a rodent called the mastomus rat, which lives in homes and sheds throughout West Africa. People get infected by breathing in particles from rat urine or droppings, or by eating food contaminated by rats. Here's what makes Lassa particularly scary. It's endemic, constantly present in West Africa, meaning millions of people are at risk every day. And unlike Ebola or Marburg, which cause dramatic outbreaks that get international attention, Lassa quietly kills thousands every year with minimal global awareness. Healthcare workers are especially vulnerable. The virus can spread person to person through bodily fluids, and many rural clinics lack proper protective equipment. Doctors and nurses treating Lassa patients regularly become infected themselves. There's an experimental vaccine in development, but nothing approved yet. Treatment with the antiviral drug Ribavirin can help if given early, but most people in affected regions don't have access to it. Lassa fever is a reminder that the deadliest viruses aren't always the ones that make headlines. Sometimes they're the ones killing people quietly, year after year, in places the world has forgotten about.
Crimean-Congo hemorrhagic fever, or CCHF. probably never heard of CCHF, but it has a fatality rate of 10 to 40%, making it one of the deadliest tick-borne diseases in the world. The virus is spread by ticks, primarily the hyaloma tick, which is found across Africa, Asia, Eastern Europe, and the Middle East. You can also get it by handling the blood or tissues of infected livestock. Farmers, veterinarians, and slaughterhouse workers are at high risk. Once infected, you develop sudden fever, muscle aches, dizziness, and sensitivity to light. Then the hemorrhaging begins. Nosebleeds, bleeding gums, bruising under the skin, blood in your urine and stool. Your liver fails. You can bleed internally into your brain or lungs. The virus can also spread between humans through contact with infected blood, making healthcare workers vulnerable. Several outbreaks have been traced to hospitals where one infected patient spread the virus to doctors and nurses. There's no vaccine for CCHF. Treatment is limited to supportive care and the antiviral drug ribavirin, which may help if given very early. But in rural areas where the virus is most common, these treatments often aren't available. Climate change is expanding the range of the hyaloma tick, meaning CCHF is spreading to new regions. Cases have been reported in Spain, Turkey, and other parts of Europe where the disease was previously unknown. As the planet warms and tick populations move northward, more people will be exposed to CCHF. It's a preview of how climate change will reshape the landscape of infectious diseases in the coming decades. H5N1 avian influenza, or bird flu. Let's end with a virus that hasn't caused a pandemic yet, but might be the one that finally does. H5N1 bird flu was first detected in humans in 1997 in Hong Kong. Since then, it's infected around 860 people. About 450 of them died. That's a fatality rate of roughly 53%. Think about that for a second. COVID-19, which killed millions of people, has a fatality rate of 1 to 2%. H5N1 is 25 to 50 times deadlier. So why hasn't it caused a pandemic? Because it doesn't spread easily between humans. Most people who catch H5N1 get it directly from infected birds. Human-to-human transmission is extremely rare. But here's what keeps virologists up at night. Viruses mutate constantly. Every time H5N1 infects a host, there's a chance it will mutate in a way that makes it more transmissible between humans. If H5N1 ever gains the ability to spread efficiently through human populations while maintaining its high fatality rate, we'd be facing a catastrophic pandemic. Scientists estimate it could kill hundreds of millions of people. In 2011, researchers conducted an experiment where they deliberately mutated H5N1 to make it airborne transmissible between mammals. The modified virus spread easily between ferrets in the lab. The research was so controversial that the US government temporarily halted it, fearing the information could be used to create a bioweapon. The modified virus proved that H5N1 can evolve to spread between mammals. It's not a question of if, but when. Meanwhile, H5N1 continues to circulate in bird populations worldwide. Periodic outbreaks require the culling of millions of chickens and ducks. The virus keeps trying different mutations, rolling the dice, looking for the combination that will let it jump efficiently to humans. Every day the virus doesn't gain that ability, we're lucky. But our luck won't last forever. When the next pandemic comes, and it will come, there's a decent chance it'll be a flu virus like H5N1. And if it is, COVID-19 will look like a practice run in comparison. And that's all for now. I don't know why you enjoy learning about viruses that could kill you in the most horrible ways imaginable, but hey, knowledge is power. Or in this case, knowledge is knowing which animals and insects to stay away from. Stay safe out there, wash your hands, and maybe avoid camping near rodent nests. Have a happy day.